We had an activation or a medical camp which was running for 3 days, and today was the last day. We started on the Thursday and it has been running for 3 days. We had a target. We really wanted to reach out to people out there. We knew that there are a lot of women and children with problems, and they don't have maybe the financing over the money they can use to test themselves, and know that I have this problem. So one of our main important targets was to reach out to all mothers, all women, even if you're not a mother, all girl children and children. Now we saw that we couldn't reach out to only women without reaching out to families as well, so we decided to reach out to men as well. So it was a general medical camp, but mostly focusing on women and children, and that's why we had services like scan and STI and UTI testing. Throughout this medical camp, I've got to learn that there are a lot of uncovered ailments or sicknesses out there in the community, and simply because people are not coming to the hospital to run these tests. Because we're running tests for free and giving treatments at a very subsidized price, and actually some treatments were for free, scans were for free, we got to discover a lot of diseases and a lot of new ailments that we actually weren't seeing on a daily basis through walk-ins. So we discovered that there are a lot of women out there who are suffering from fibroids. We have got that a lot of girl children out there having cysts, they're having PIDs, infections, STIs, but they're seated at home. We also discovered that there are a lot of men out there also who are sick but are seated at home doing nothing about it, simply because I am a man, I have to be strong, or they don't want to come to hospital, because we found out that the men also that came in were sick. In numbers, we had about 189 people on the first day. The first day was a bit low, but the second day and the third day, second day we had 280, and the third day we had 350 people. So I would say the activation or the medical camp has been successful, although we were a bit limited on the on the supplements like medication. We expected a number of about 300, but we got a number of about 600. So we were overwhelmed by numbers. We shall do this again for sure, and the next time we do it, it will be bigger and better, because now we have gotten to know what is going on in the communities. Our main aim was to help, to make sure that at least we reach out to people and offer a free service, to offer to them, at least they get to know what is paining me. And I believe through this we have been successful. We are still here for those of you who would like to come back and maybe get further treatment or follow up with treatment. We shall keep following up with everyone, and I would like to thank the whole community at large. We have got people from all districts, not just in Mbale. We have got people from Kamonkoli, we have got people from Mukono, we have got people from Manafa, we have got people from Namisindwa. I would like to thank people from all districts for coming and making this a success and a beautiful thing for us. We pledge that we shall do our best in following up with treatment and giving the best care for you out there. Thank you. Mostly the ladies out there, the girl child and the women plus the children. They are seated at home mostly because of poor funding or poor financial, because most of the people that we're finding with severe UTIs or PIDs, which is a pelvic inflammatory disease, an infection of the uterus, they were within that age group of 18 to 25, and they were mostly ladies. But when you ask them about the previous history of why haven't you gone to hospital, because when you find a disease in its later stages, you have to be worried. You have done a scan, you found someone with gross cysts, you have to really be worried. You have to find out why this person had not come to hospital, and you find out that most of these people they have had this problem for a long period of time. But when they go to the drug shops or pharmacies, I'm not bad-mouthing drug shops and pharmacies, but they go and self-medicate. Self-medication is not really a good thing. So mostly women and children within the age group of 18 to 35 for the women, and the children of under 5 years. tubadde tulina medical camp oba okutuusa kwa services ez'obwerere ez'ebyobulamu ku bantu ebaddewo ennaku 3 eziyise emabega, yatandika ku Lwakuna ewedde leero. Njagala kusooka n'okwebaza abatuwuliriza bonna n'abazze okubeera mu medical camp eno. Mwebale nnyo okujja okubeerawo okufuna ku services zetubawadde. Although twabadde nga twafunyeko ku bantu abasinga ku be twasuubidde, naye tukkirizibwa nti next time oluddako tugenda kuba nga twetegese, lwakuba twali tusuubira enamba ya abantu nga 300 mu nnaku zonna, naye twafunye abantu kumpi 600. Njagala kwogerako ku bintu bye twasanze mu medical camp eno, nti nno abakyala abasinga n'abaana abato batudde ewaka nga batidde okujja mu ddwaliro, maybe because tebalina obuyambi nti ssente ze bagenda okukozesa okwekebeza oba okufuna ku treatment. Kakati engeri gye twaleseemu kampa eno ne tugamba nti tugenda kwekebeza abakyala ku bwereere, tukole scans, tukole dental check up, tukole byonna ku bwereere n'okuwa treatment ku ssente ntonotono nnyo. Actually ne treatment ezimu zabadde ku bwereere, ndowooza abantu baasituse ne bagamba katujje tukole test zino tutegeere ki ekitutawaanya. Era twazudde nti abakyala abasinga ennyo batudde ewaka naye balina ebizibu kati bamanyi oba nga bamanyi naye tebagala kujja mu ddwaliro. Twasanze nnyo abakyala abalina infections, twasanze nnyo abakyala abalina fibroids oba ebizimba ku nabaana, cysts ebyo. Twasanze abaana abato nga balwadde balina pneumonia, balina omusujja gwa ensiri nga batudde ewaka, nga tugenda okugoberera nga tusanga nti bano abantu babadde balwadde okumala akabanga kanene nga naye just tebagenze mu ddwaliro, nga bagenda mu pharmacy oba ku kadwaliro akadrug shop akatono neyeegulira ku mpeke n'amira. Naye ekyo ekitali kirungi lwakuba ogenda kumira mpeke ezitagenda okuyamba. So njagala kweyongera okubeebaza nti no mwebale kujja, naye ate njagala kweyongera okubagamba nti mweyongere kujja ku ddwaliro, temugendanga kwegulira eddagala oba empeke lwakuba kigenda kubonoona. Nsuubira nti wetugenda okuddiramu okubeera ne kampeni tugenda kikola nga kinene ate nga tugenda kutuusako buli kimu kubwereere, lwakuba kati tufunye enamba entuufu gye tusobola okuba nga tugwamu, ate tuba nga tugenda planingirako ekintu okusingako awo. Mwebale nnyo kujja, mweyongere kujja ate mulindirire ekiddako.